Hi everyone, this is Ekaterina, and today I'll be talking about Cognitive Behavioural Therapy or CBT. Before we go too much into detail, I would like to first use this opportunity to introduce a book to you. It's called First Steps in Counselling. I'm using the 5th edition, which was published in 2021, so I think it's the last edition there is. Got it as a Christmas present, and even though I haven't gone through all of it yet, but I can already see what a valuable resource it is and that it will definitely support me in my studies. So for anyone who is doing a similar study program, trying to become a therapist or a counselor, I would definitely recommend this book to you. It's so easy to follow. And even for those people who are just generally interested in counseling, if you've been thinking about maybe doing counseling sometime soon and you would like to learn more about the process, what to expect, again, I think it's a good book to get if you would like to get some of those questions answered before you start the process. And finally, just wanted to mention that soon I'll be adding a new playlist in this channel about mindful reading. I'll be sharing some of the titles of the books I have read in a couple of last years, things I've used for my self-improvement, for better self-awareness, as well as the books I use in my study program. So this book will be definitely featured there, more in detail soon, and definitely look forward to it. And now let's talk about CBT. So from my experience, CBT is one of the most well-known therapies. I certainly knew about it even before I started my counseling and before I started the study program. And this is probably because CBT is one of the most readily available therapies through National Health Service or NHS here in UK. So if a patient comes to GP and they have anxieties, distress, depression, panic attacks, anger issues, some sort of childhood traumas that are now again causing some anxieties and distress, even the obsessive compulsory disorder or OCD, in most of such cases, the GP will prescribe to you the CBT. And another reason for this is because, as far as I've heard, it doesn't take that much time for the medical professions to be trained into this therapy approach. So it takes about 1 year. And also it's quite short term. So it's really focused on the problems the client or, well, the patient has at that moment. And it tries to find the quickest way of resolving them. So it is short term. It doesn't take years, it is usually a few months. So I guess for NHS it's obviously a much preferred approach because it delivers quick results and also they can train more professionals in order to support all the people who require that help. Now, I'm not trying to say that CBT is not good just because it's cost efficient, but certainly it works for some people and it might not work for others. So if you get prescribed CBT and you do it and at some point you feel that it is not working for you, please explore other options. Don't just give up. As I said, for some people it's really effective and for some it's a bit less. So make sure you find the therapy that suits your needs. So what exactly is CBT? And as the name stands, Cognitive Behavioural Therapy, we're talking about behaviours, and cognitive is the term used in psychology for thinking. So we're also talking about thoughts. And generally, according to the CBT, our thoughts and our feelings affect our behaviour. In fact, it's almost like a cycle. So thoughts generate feelings, feelings generate behavior, and behavior reinforces the thoughts. So as you can imagine, if by any chance at some point you create maybe some unhealthy behaviors, you just keep doing that, and the more you're doing it, the more you believe that's the right way of doing it. So sometimes it's really difficult for people to really break that pattern and to just really understand that what they're doing is not always the most logical approach and is not always the most healthy approach. And this is where the CBT helps. Because with the help of the counselor or the therapist, they'll help you really to establish what behaviors are based maybe on assumptions as opposed to true facts, in which cases you could react a bit differently to come to a better outcome. And they will work throughout with you with some exercises to really help you slowly change that behaviors and in a way almost unlearn those behaviors and replace them with new healthy patterns of actions. So what can you expect from the counseling in the CBT process? Well, in comparison to the person-centered therapy, in CBT, the counselor really needs to have the expert role because they've been trained in how to do CBT therapy. They actually have almost like a manual protocol they have to follow, and therefore the CBT sessions are usually much more structured. There is plan, as I said, there is a particular steps that the counselor needs to follow. Now, they still have to have all the counseling skills we covered previously, asking the right questions, paraphrasing, summarizing, active listening. But it's also important for them to be able to gather the information from their patients and analyze it correctly within the CBT framework, so that then they can almost challenge their clients with the information they've given and try to help them see how some of the behaviors they have done might have been not the most effective ones and how we can slowly change our habits. Now, again, this is almost like an educational process. The counselor might actually try to even explain to the client the whole theory behind this process, and it is quite important that the client is cooperative in this process. They're motivated to change because, as you can imagine, nothing changes overnight. You really have to do some work. So it is very common for the clients or the patients to get some homework or little exercises they have to apply in daily life, and then come back to the next session and discuss what they've done, how they felt with the counselor. And only by doing that you can really change your behaviors. There's actually a book called The Power of Habits. I also want to cover it in this new playlist that I'll be opening up soon. So it's a book I read a few years ago, and it describes how behaviors and habits are created and how we can change them. Now, I tried it on myself, and I can say that yes, some habits were a bit easier to change and some much harder. But in this book, they also say that it takes approximately 6 weeks for us to develop a new habit. So just from that, we cannot really change ourselves very quickly. It takes time, and we have to be patient with ourselves. But certainly by working hard with the counselor in the CBT, by doing all the homework and exercises they provide, there will be change, and this change will certainly be more positive for that person. Another thing that the counselors will also try to teach their patients is how to stay calm and neutral in very distressing moments, because when we are in a very stressful situation, it's quite common for us to get really emotional, really distressed. And now we have two problems. We have the actual situation and we have our feelings of distress. And because of that, it is likely that the way we will react will be not the best way we would have liked to have reacted. So we might try to avoid the situation and in the future do that again and again, just avoid a particular as I said, incident, a particular place that we have bad memories with, particular type of arguments. And this means that again we're going into that unhealthy cycle of denial, of avoidance, as opposed to maybe resolving a situation in a more calm and logical way. So again, by learning how to stay calm, we also allow ourselves to take more logical decisions in that situation and to adjust our behavior correctly. So I'm certain that there's a lot to be learned still about CBT, as I've only done an introduction course here and shared with you the top details. But as I will be coming back to this topic throughout my study, I'll make sure to share more information in this channel. And one of the last things I wanted to also share with you is a very simple ABC model that counselors apply in CBT. Now, in my course, they've actually given us an extended model because it also had the D and E letter, so I'll share that one. But it's quite easy to remember. So one of the things that the counselor will really try to focus on throughout the session is to establish the activating event. So that's the letter A. We're trying to understand when exactly has this behavior started. Was there a particular situation or traumatic event that has occurred in the life of their patient? B stands for belief. What sort of assumptions or beliefs the person has around that event? C is for consequences. So what were their feelings, their thoughts, their emotions, what sort of actions they've taken at that moment. So those three are very important in CBT to really establish what has happened, what we thought about it, and how we acted. And then we're going into D, which is disputation, or challenging our unhealthy behavior. We start to really think, is that the best we could have done in that situation? Was it logical? Was it based on true facts or just some assumptions? And finally, we go into E, which is the new effective belief is being created by the person. So they replace their unhealthy behaviors with the healthy, good ones, and they start to use more logical thinking. And one more thing I wanted to mention about CBT is an additional kind of important lessons that you can learn by having those sessions. And it's about self-acceptance and acceptance of others. Now, I think nowadays it's quite usual for people to sometimes set up very high targets for themselves, almost unachievable. You know, we start to believe that if we don't have the love and support of every significant person in our life, then the life is meaningless. Or perhaps you believe that you have to complete every single task perfectly and there's no place for mistakes. If you think this way, then I would say maybe consider thinking if you'd like to have a CBT or some sort of therapy, because by learning with the counselor how to accept ourselves as we are, we learn that we cannot be perfect, and at the same time it becomes easier for us to also understand that other people are not perfect and therefore they have similar struggles like we do and probably have the same worries we have, and again the life becomes a bit easier, so you're less stressed about things happening in your day-to-day life. And finally, before we finish, I just wanted to give you a couple of more examples of the type of issues you might want to address with CBT. And this is because I often hear now from people telling me that they don't fully understand what is depression or what is anxiety or when exactly you have to seek professional help. You know, they almost think of it as some sort of strange diagnosis you will get from your GP, but you cannot spot it yourself. So here's a couple of examples. You can be prone to generalization. Let's say your ex-partner has cheated on you and now you believe that there's no point trying to build any new relationship because you'll be cheated on again in the future by all your possible future partners. So a single event has created a whole belief around a topic. So that's one of the issues you might want to address with CBT. Another one would be magnification. For example, you're thinking that the consequences of a particular event are much bigger than they are. You're late to your work meeting and you think now that there's no way you will get a promotion, your whole career is over because of that one single meeting that you came late to, even though it was not your fault. So again, maybe if you have a lot of those sort of distresses in your life, think of doing some counseling. And one I liked very much, and I haven't heard this term before, is called fallacy of fairness, and it's referring to the fact that many of us grow up thinking that the world is fair and everyone will get the same things and everyone will be living to the same standard. And then we hit the reality and realize the world is not like that. Not that I don't think it should be that way. I would very much like for it to be fair, but that's the reality of things, and we cannot always get the same things. And if again you are struggling with that concept and it's really affecting your day-to-day life, then again maybe you would like to explore more some counseling options. So I hope you enjoyed today's video. Next week we'll be talking about psychodynamic approach by Freud. And initially I would say I was a bit worried about this, as I've heard some things about Freud's therapy and I wasn't certain if it was my cup of tea. But now that I learned more about it, I'm definitely becoming more open-minded to it, and I think it's still applicable in modern therapy. Remember to like the videos, please subscribe to my channel not to miss any future videos, and remember to take good care of yourself. I'll see you next week. Bye bye.